It's pretty common knowledge that one of the main symptoms of inflammatory bowel disease, whether it's ulcerative colitis or Crohn's disease, is diarrhea. However, we all know that diarrhea can be caused by lots of other things. So before people run off to have a colonoscopy, it's often more prudent to think about non-invasive tests that may be helpful in order to try to figure out whether something like a colonoscopy is warranted. And so non-invasive markers, i.e. blood work and stool tests, can be very helpful in figuring out whether somebody may have inflammatory bowel disease or whether they have something else. So in the recent literature, there are studies looking at certain kinds of proteins that can be found in the stool, and these proteins are reflective of active inflammation within the gut. Active inflammation can be from an infection or inflammatory bowel disease, but if the diarrhea is due to something that you ate or due to irritable bowel syndrome, then these tests would be negative and not show inflammation. So they can be very helpful as a screening tool for whether more invasive tests are needed. And when can this be helpful is particularly in children, where the concern for doing invasive tests is much higher because a colonoscopy does require general anesthesia for a child. And so the popularity of some of these non-invasive or stool tests has grown, and certainly there is a growing evidence base for their use and scientific evidence that non-invasive stool testing may be very helpful as a first stage before moving on to something as invasive as a colonoscopy, or even x-rays. X-rays, as we know, do expose you to radiation and can be uncomfortable and timely, or time-consuming. And so some of these tests, like just sending a stool sample, can be very helpful in helping physicians or other care providers screen those patients who really do need further workup and testing.